I believe every relationship begins with a question. And at Bank of the Ozarks, we love finding the answer. So when I tell my customers I can do something, I do it, and I get it done quickly. Bank of the Ozarks is one of the top-ranked banks in the country, but we still make decisions locally, face-to-face. You have a friend here. Bank of the Ozarks.
Troy Wells is the new CEO of Baptist Health. Needless to say, there's a little bit happening in the healthcare sector in Arkansas and across America that is forcing some changes. We are glad to have him with us this morning. Thank you for being here, Troy.
Thanks for having me.
And congratulations on your new job. You're the new CEO of Baptist Health. You follow in the footsteps of a legend, Russ Harrington, there for decades. They say that it's always, you don't want to be the guy that replaces John Elway. You want to be the guy that replaces Bubby Brister, who replaced John Elway. How big are the shoes that you have to fill?
It's a tough guy to follow, for sure. Russ is a legend in Arkansas and in healthcare. He's been a leader in the state and in the country in providing healthcare to people. And it's a big challenge to replace someone like that. For me, it's to build on his legacy and to try and make it better.
Yeah, and he's going to be with you guys through the transition for some
he
time
is,
as
that's
well.
right.
That'll be good.
That's right.
Well, let's talk about what some of the challenges you guys are facing. The Affordable Care Act has been there. There were Medicare cuts to the Affordable Care Act that was supposed to be offset with Medicaid increases,
Right.
which Arkansas has kind of done through its private option. But has that been a fair trade-off? What's kind of been the balance of how that has operated?
I don't know if it's fair in terms of dollars, but assuming the private option stays in place in Arkansas, stays funded year after year, it'll really help. The dollars won't be quite the same, but if you take the private option away in Arkansas, it certainly gets a lot worse. It's pretty devastating. And then the other thing to keep in mind is the sequestration cuts happened all about the same time that the Accountable Care Act cuts came into play. So that's been an additional burden and challenge for healthcare.
So what adjustments do you make? Obviously, you downsize in some places, you belt tighten in other places, but do you see opportunity also where you grow revenue?
We do see some opportunities. Some different care models are going to evolve in healthcare, not just with Baptist Health, but across the country. We're seeing that. Healthcare providers are continuing to look at new ways to provide care, to increase access to patients, to provide the right care to the right people, the right time. Today we have challenges where too many people get too much care, some people don't get enough, and it all costs too much. So there's going to be some opportunities. The people that figure out how to lower cost, improve quality, provide more access, and create healthier communities. There's going to be some opportunities there for health systems.
Give me an example of one of these creative illustrations that you're talking about, just something that maybe people are familiar with or will soon be familiar with.
Yeah, a great example is something that we're doing right now at Baptist Health. In our clinics, we have people called care managers, and these traditionally have never existed in the healthcare system, where we're reaching out to patients to try and keep them healthier where they are, trying to prevent some episodes where they might have to come to a hospital or come to a physician's office, reaching out to them proactively as opposed to waiting till they have some acute episode that could have been prevented potentially. So there are opportunities to improve health, improve health care, and provide more access that way.
One of the things we were supposed to see with the Affordable Care Act and with the private option is that we will see people utilizing insurance as they access the healthcare system versus the numbers of uninsured that we were seeing previously. What are you seeing in your numbers that you can tell me without violating some sort of confidentiality?
Yeah.
Are you seeing fewer uninsured patients coming into the system now?
We are. We sure are. Matter of fact, the percentage of patients without any coverage at all is almost been cut in half at Baptist Health so far this year. We hope that trend continues. We'd love it to go to zero where everybody had coverage. We don't know that that's ever going to happen. However, so far the results have been very good, and we're seeing fewer uninsured patients, whether it be through our emergency rooms or in our clinics or in our hospital.
Are you seeing more people, because another goal was to access primary care physicians, get people out of the ER where costs can be more expensive? What are you seeing in your emergency room visits?
Visits in the ER continue to go up. That's been a trend that's going on at Baptist Health for a long time. Nationally, those numbers have been relatively flat. In some markets, others it's gone up. We've seen an increase, continue to see that, albeit at a slower pace. But we do see patients looking for other ways to access the system. We're starting to see patients show up in our clinics who before didn't have access to coverage, so they didn't come to the physician office, they waited till they were really sick, came to the ER. We're seeing that start to change. Awareness is getting better and access is getting better. You've seen a lot of urgent care centers pop up around the Little Rock area. That's happening nationwide, and that's all I think in a response to some new demand for services that may be provided in a different setting.
You guys are also moving into Conway with a standalone facility up there. I think $165 million. Can't remember how many beds it is at this point in time. You probably correct me on that. But what's attractive about the Conway market? Why do you feel the need to put a facility there?
Several things, really. One, the community. And when I talk about the Conway initiative, I'm really talking about that whole region. There's 4 or 5 counties there in the state that we want to serve through that market. But the community not only is an attractive place in terms of growth in Arkansas, but also a lot of those patients are patients of Baptist Health today. And so as our customers, we want to provide Baptist Health where they want it. And we've heard a resounding yes when we said we're interested in the Conway market. The other thing that's real attractive to us is a group of physicians in Conway who've been very involved, came to Baptist Health asking us to come and do this. We wanted to do that with them. And it's really fun to work with a group of engaged doctors that we know we can be successful with.
Last question for you. We've got about 30 seconds here. Sure. The private option, you mentioned it earlier. How important is it to the viability of Baptist Health that it be successful? How important is it to healthcare in Arkansas, do you think?
Well, the mission and purpose of Baptist Health is to improve healthcare and improve health for the people of Arkansas. We think the private option gives us a greater ability to reach people that otherwise wouldn't have access to care. If we can't get to them and they don't have a way to pay for certain services and certain ways of taking care of them, then it's real hard to meet our vision and our purpose and our goals. So we're excited about it. We hope that the legislature will continue to fund the private option. We think it's real important for people in Arkansas, and that's our primary concern.
All right, Troy Wells, new CEO of Baptist Health. Thank you very much for being with us.
Thanks, Roby.
Hope to have you back on again soon.
Thank you very much.